Lead time and lead time bias. Let's start with the definition of lead time. This is the period between early detection of disease and the time of its usual clinical presentation. To help us understand what lead time bias is, I want to start with a video that gives a good explanation.
Hi, Terry Schoenfeld for UAB School of Medicine. There are three main biases you need to think about when you read a screening study. I'll discuss one of them, lead time bias, in this video. We'll talk about what that means and how researchers can design their study to prevent lead time bias.
So let's look at the course of a typical disease. There's the biologic onset of disease, and it runs its course and then develops some outcomes. Now, somewhere during this course, symptoms will develop and a diagnosis will be made of the disease. But prior to this, there's an asymptomatic phase where the patient has no idea they have the disease, but it has developed. And this is where screening occurs. Screening is the detection of asymptomatic disease. And the hope is that if you detect it earlier and there's effective therapy, that you can improve the outcome of the disease. Let's talk about lead time bias. So lead time is the time between detection by screening and when symptoms would normally develop and the diagnosis is made. Now, the problem with this is that if you start counting time of survival, and survival is the key here, from date of diagnosis, moving that date of diagnosis earlier makes survival of that disease appear longer, even if treatment is ineffective. So let's look at this graphically. So we have an unscreened person, they have the onset of disease. Here's that asymptomatic phase. Here's where symptoms develop and a diagnosis is made. And this green box is the time of survival, knowing you have that disease, and then ultimately the patient dies. Well, if we take a screened population but early treatment is not effective, what you can see here is that we've moved diagnosis earlier. That's what screening is supposed to do. So this green box of survival, knowing you have disease, looks bigger and looks longer, but you can see here the date of death is exactly the same because treatment is not effective. So we've made it look like the patient has lived longer, but in fact all they've done is lived longer knowing they have the disease, but they die still at the exact same time. So this red bracket is representing lead time. So lead time is this time right here from diagnosis by screening to when diagnosis would have occurred. And the way we get
In summary, if a screening procedure does not improve health outcomes, but only allows us to know that we have the disease sooner before we have symptoms, that creates a situation of lead time bias where it seems like the treatment is effective and allows for longer survival time when in fact it's not effective. Lead time bias is a cautionary tale, and when evaluating the effectiveness of the early detection and treatment of a condition, the lead time bias must be subtracted from the overall survival time of screened patients to avoid lead time bias. Otherwise, early detection merely increases the duration of the patient's awareness of their disease without reducing their mortality or morbidity. There are numerous cancer screening procedures that were thought to improve survival until lead time bias was addressed.